Alzheimer's, a disease of the brain that impacts on memory,
emotion, decision-making abilities and other brain functions, affects 1 in 10 people over the age of 65. It is a growing epidemic in many countries, and Indonesia is no exception. In 2013, 1 million people were thought to be living with dementia. By 2030, that number will double. Despite the significant prevalence, poor knowledge and widespread tendency to think of memory loss as a normal part of aging has potentially resulted in many undetected and untreated cases of the disease. To tackle this, On-Track Media Indonesia and Alzheimer's Indonesia, supported by Grand Challenges Canada, initiated the project Kickstarting Alzheimer's Awareness in Indonesia under the STARS and Global Health Program from 2014 to 2015. The campaign was covered by over 1,000 published news articles and featured in more than 22 regional and national TV and radio talk shows, ultimately reaching out to an estimated 66 million people across Indonesia. Since then, ALZI has continued to hold caregiver meetings, training classes, and other activities such as educating awareness raising for over 10,000 students across Jakarta. Public-private partnership will remain a crucial part of our efforts to improve the quality of life for people with Alzheimer's and their caregivers in Indonesia. For World Alzheimer's Month 2015, electronic billboards across Jakarta will once again show the 10 signs video, courtesy of the Jakarta local government. Public parks in the capital will also be activated to provide a place for risk-reducing activities such as regular physical and mental exercises to support an active aging society. Jangan maklum dengan pikun. Memory loss is not a normal part of aging.
Thank you, Ibu Judy, for inviting us. I would also like to thank you because the other two speakers are dear friends. So thanks to her, we have a reunion today. It's nice to meet them again in this session and contribute our experience. So my name is, in the birth certificate, is Kusuma Dewi, the goddess of flower. And if you see me, I don't think I look like goddess nor flower. And I'm a tomboy, and my sister gave me DY as my nickname. And the topic is in advocacy and partnership with trust. And the video, 2-3 minutes video earlier, is representing the experience of how we do advocacy and partnership, not only with government, but also private sector, other NGOs, individuals, and all that. So this is how everything started, actually. My mom was diagnosed with vascular dementia in 2009. And I was pursuing my Master of Public Health in Australia when my dad called and said my mom was diagnosed with malnutrition and dementia. And I thought malnutrition is only in Africa or in East Timor, but it's actually in my house, in my neighborhood. And that's because she forgets to eat, and she also has shown symptoms of dementia, which is a neurodegenerative disease affecting the brain, cognitive, affecting people, memory loss, emotion, and executive decision. If only I knew that my mom, the symptoms 20 years ago, she's already showing symptoms of that. There's so much that we could do beforehand. And I have some flyers, brochures for you to have, so you can share to your family about this. So my mom passed away exactly on Kartini's day, so her legacy continues. She's my forever Kartini, and my sunshine, my inspiration. And because of the lessons of this journey with her, initiated the Alzheimer's Indonesia movement. And Tika is one of the person that actually, it was the first memory walk that we did on the video. She was also actively participating in that walk, an intergenerational walk. And that's the first time we got elderly community to join and all that. So This is, you have it in your PDF, I think, but basically, globally, my mom is 1 out of 50 million people with dementia globally. And out of 50 million in Asia, it's actually around 22.9 million. So almost half of the people with dementia is in Asia. And that's because of the age expectancy. In Indonesia, it's around 72.9. And it's affecting women more than men. And also, it's very costly. It's approximately, for Indonesia, it's approximately around $2.2 billion. And that's for social, for healthcare, informal care as well. These are just graphics that we did as an organization, created a vision, is a center of excellence to provide support, not only for care, but also for risk reduction. And this is where the nutrition component takes part. Because again, like, I still remember that my mom cooked every day for my dad and family, but she actually ate junk food in the afternoon because she's focusing more on giving to the family and didn't really have enough time to prepare nutritious food for herself. So it's approximately 1.2 million people with dementia, estimation, and there's a prevalent study in Bali and Yogyakarta on this. This is just a sketch. It's part of the advocacy journey that I did in understanding people with dementia at the center. And other partners, if you can look at this, perhaps this is the real, the more clear version. This is like, my brain was just thinking who are other organizations that is involved and all that. And this is the stakeholder mapping. So if you see people with dementia, how does private sector play a role? What does the government? It's not only Ministry of Health, Ministry of Social Welfare play a role there. Ministry of Workforce related to care workers that goes around 250,000 care workers in Taiwan have no clue at all on how to deal with dementia. And we received an invitation to give training in Taiwan to help Indonesian migrant workers. Healthcare from non-pharma and pharmacology and all these agencies, international and NGOs and institutions. Of course, it all started with a problem. There's a problem that we want to solve, and there's a root cause of lack of knowledge and awareness. All my siblings are graduated from University of Indonesia. We're supposedly fine in education, but nobody knew that mom, welcome Sila, a friend from Sila from WHO. Actually, she's actually one of the volunteer and the first person that I recruited. And thank you for coming. Alzheimer Indonesia. She was working for WHO, and her office is actually just one floor below the Minister of Health. So it's perfect for advocacy because whenever we send a letter to the Minister of Health, I asked her to knock the door of the Minister of Health's office and say, we need a response for this. So you need to be also proactive and know what you want and what to ask. What is the ask? So the root cause is lack of knowledge and awareness from all stakeholders. Root cause 2 is the lack of diagnosis, care, and treatment. Related to them. And one of the entry points is actually from issues related to diabetes, hypertension, and all that. And root cause 3 is lack of support and information for caregivers and public in general. So understanding the root of cause will lead you to design the key messages. And when we talk about advocacy, it's from the Latin word advocare. I always like to say it. It sounds like I'm Italian. Advocare. It's speaking on behalf of someone. So I will forever speak on behalf of my mom because she plays a very significant role. Because of her, I'm doing this. It's my purpose-driven work, and I apologize to you because I have to leave around 3:15, 3:30. I have other commitment and after this, but I'd like to share this advocacy and partnership lessons learned that we've been going through. So there's a crucial role of non-government organization, together with government, together with private sector and all that, not only speaking on behalf of someone, but also walking together with them. So it's not a command control style, it's really like, togetherness. So from Advocacy, and there's also fundamentals of advocacy. You need to have a strategy. You need to have data. Just start by a simple data of where you live and know how many elderly live there, what's the population and all that. What are the disease, hypertension, diabetes are the highest data in my environment, for instance. The key messages must be simple and clear, and that's why we have the key message of jangan maklum dengan pikun. Do not underestimate memory loss. This campaign to build support, I'm lucky because there's no longer Sarah Sehan's show now, but I had the chance of being invited by her in her TV show, and also Kick Andy, maximizing this network of media to spread the word, set realistic demands. So what's your target, and provide solution as well as building coalition network and be present. So this is the elements of advocacy, which is facts, because policymakers need to know the impact of the disease and what you're aiming, what are you aiming, and what's the bigger picture of things. So we have sustainable development goals. We have Nawacitra here in Indonesia. We have, and it's under component 3 of improvement of quality life for all well-being. Spokespeople, the face is important. Champions, all the allies that can be the drivers of your advocacy work. And partnerships is a must. You cannot do things alone. And a call for action. What do you expect? So these are some things to be considered, because sometimes you attend a meeting without knowing what to ask. And this is something that it's a homework that you need to know in advance. Like if you meet a mayor or a governor, you know exactly what to ask and how it linked to their system. I remember during the previous government era, there's this orange troops, there's green troops, and for all these services for the public. And I just simply text and ask the governor, can we have purple troops? And these purple troops' job, we suggest, is to help elderly that's missing and link with the social welfare office. So these are the things, the homework that you can also start to explore when you want to do advocacy. And also have a social marketing mix. You understand the people, and if it's product here means the behavior that you like to target, what kind of behavior change that you're aiming. So from people who don't know, for instance, dementia, we're aiming to have, 1 million people know 3 out of the 10 key messages of dementia, symptoms of dementia. Place where exactly you want to conduct your training or programs and all that. So the promotion, the public. First strength is the funding. You want to make sure that you ask partners to chip in, policy, and definitely partnership. These are the 2 components I'd like to share about building partnership and advocacy. So the component of building partnership, we basically want to see the improvement of how health policies could be turned to real implementation. And this is one of the homework, I think. There's many policies, but whether it's implemented or not, you're questioning it. And that's where civil society play a role in becoming the watchdog, so to speak. So these are how to build partnership of the components that to be focused on. And as I mentioned, because of my mom, in 2013, the notary actually asked us, the founders, to sign the official paper of Alzheimer's Indonesia, and it's exactly on my mom's birthday, like 3rd August. As if the universe is saying, confirming, this is the mandate to be done, because people don't know about dementia. And it's a 250 million population in Indonesia with 20 million elderly and estimation of 1.2 million people with dementia. And I think this is like the 6th year. We have more than 5,000 volunteers and 21 chapter leaders in 21 cities with no funding in the first 3 years, purely volunteering. And on the third, going to 4th year, we received support from the Ministry of Health Netherlands, not Ministry of Health Indonesia. So Ministry of Health Indonesia, I don't know whether because there's 350 years of colonization in the past, but they have funding to help. And for the second round, they already say, end of this year will be the ending of this funding, and they basically say, we need your government to chip in as well, a matching grant. You know, so we're trying to advocate our government to also chip in on this, which is a challenge. We have around participating people on caregivers meeting in 21 cities, and it's all organic. Like because of the media exposure, people reach out to us through Facebook, through WhatsApp, and say, I want to do caregivers meetings or support group or activities for the elderly. Judy, I asked actually personally to help in talking about nutrition in the Alzheimer Indonesia Depok because she lives in Depok. You know, so yeah, like you maximize your expertise and what you can share in your own neighborhood. And with WhatsApp, everything is really easy. So the vision is to improving quality of life of people with dementia and caregivers in Indonesia with the tagline of Jangan Maklum dengan Pikun, and we also have tagline Sayang Ortu. You're not cool as a young generation if you don't spend quality time with your parents. And that quality time doesn't have to be physical. It can be over phone, FaceTime, Skype, Zoom call, whatever. You know, like these are the quality time that actually could improve quality life, both you and your parents. And that's the campaign we'd like to explore. And the strategy, again, my friend Tika was also involved in the beginning of this, of the process on what would be the strategy. You want to have the goal. What is it? So we come up with this. This civil society will be the voice, advocare, the voice of people living with dementia, and the caregivers, empowering them with knowledge and providing them with services. So these are the ultimate goal. And the pillars on capacity building, on advocacy, on communication and fundraising and all that, that's the pillars that that help us to reach this goal. So it has to be very clear and with really clear activities that could be measured at the end. I need to share this because this is something that I envisioned in 2013. So advocacy, what is the plan? What is the strategy? So I know if I only focus on national goal, it will be challenging. So we also, together with the ALZI volunteers, say, let's set up a province goal as well. So the goal nationally is to have the Dementia National Plan launched in 2015 and have the National Asia Pacific Conference in 2017. And in province, have a decree of a dementia-friendly city. Very happy that the decree happened in Balai Kota under the previous governor, with having officially having purple troops as the first ever troops to take care of the elderly and all that. And the 2017, Indonesia hosted the first ever conference on Alzheimer. But the first one is just a bit off because the national plan was finally launched, a delay actually, in 2016. But this was written in 2013, having a clear vision. This is the high level advocacy we want, and it has to happen no matter what. And it has to be continuous. We cannot just send a letter without asking, without being actively pushing things to happen. And the goal of behavior change related to awareness raising is the caring for elderly is increased and promoting a healthy lifestyle habit. Because all these things that link to behavior. And dementia, for instance, risk reduction, ways to reduce risk of dementia is including consuming vegetable and fruit every day. Who's actually practicing that, applying that? Eating fruit and vegetable? Yes, only one? 50% in the room. I'm concerned. This is a nutrition class, no? So I was expecting people will just raise up. Fruit and vegetable every day. Physical activity 30 minutes a day or 150 minutes a week. Who does that? Oh wow, only 5. Okay. There's a research state that 150 minutes physical activity could reduce risk of dementia and other non-communicable disease. So there is a literature on that. So that's the behavior that we aim on. And in terms of capacity building, again, I look up to the documents from the past. So there's this vision of a health system strengthening program, targeting what does doctor need to do, nurses, caregivers. Doctors need to do diagnosis, detection, screening. There's no medicine, there's no cure for dementia. It can only decline the progressivity. So that's why this reduction program is important. And nurses have to also support by home care, conducting long-term care and all that. And for caregivers, there's domestic workers type of caregivers, and navigators are the ones that we thought could help. The ex-caregivers or caregivers themselves could help navigate how to journey this journey of caring of dementia. And this is the advocacy that we've done with several high-level government, from the previous Ministry of Health to the governor, the King of Jogja, previous governor, and the governor of Central Java. Just an example of the advocacy we've done. Yesterday, one of our Alzheimer Indonesia Bogor conducted advocacy to Bima Arya, the Wali Kota in Bogor. So these are things that we're working on constantly. And this is just an example of partnership that you saw in the video, because CIMB did a color run, and I was expecting there's a purple color, but they have their own set color, so that's something that you cannot advocate. It's already a system, they do the color run everywhere in the region. But CIMB Niaga is now exploring support from supporting Alzheimer Malaysia. So HSBC, the bank, just recently became the first ever dementia-friendly bank in Hong Kong. So we're trying to help HSBC in Indonesia and other countries, and these are partnerships. Meaning, apparently in Hong Kong, there's many people with dementia or elderly that went to the bank and don't know what to sign, and they're being abused by their own family, and their money is gone completely, and all that. And so you cannot underestimate this disease, because it really created so much drama in a family, and I experienced it myself. So these are examples of partnership. For instance, the government, local government of Jakarta gave 30 Videotron space the whole September. And thanks to partnership with private sector, last September, the whole month of September, Bank Central Asia in the Tamrin area also have this video, including all these collaboration with Gramedia, for instance, the first ever book that I wrote with a friend, and seminars and all that. So these are partnerships and collaborations that we work on. As I mentioned earlier, the risk reduction approach is what's good for your heart is good for your brain. 30 minutes a day, physical activity, consume vegetable and fruit every day. You stimulate your brain by, organizing things, or, participate in a gathering, or, all these things related to stimulating the brain to be active constantly, and socializing. So these are the things that people can do to reduce their risk. This is just a map of the Indonesia chapters, all the activities. There were competitions like cooking competitions, actually, recently in Solo. They're partnering with Transmart. So Transmart in Solo was approached by our team and say, okay, let's do a cooking competition of elderly. and it was a hit, and now we want to take it to the next level on a national level. So these things are done through all these advocacy work. And one of our champion in Netherlands was so lucky because I mentioned to her, Jokowi will be in Den Haag, and she's like, okay, I'm gonna be Jokowi no matter what, because it's so hard. And she had to receive some what do you call it? The bodyguard wasn't too nice to her because he's trying to protect Jokowi, but she was so adamant in getting this photo and having the president was holding the brochure as well. He's just not seen here. But our champion in the Netherlands, she married a Dutch guy and lived in Groningen, which is really far from Den Haag. But 3 hours train, she took that 3 hours train because she knew what to ask and advocating. And now the ambassador of Netherlands, Indonesian ambassador in Den Haag, always supported her with spaces, venues, giving free tables for some seminars and all that. So that's the key of advocacy and partnership. You keep on chasing people, but knowing what you want. And all these things are activities in the Netherlands. They did a pocho-pocho with 500 people in the Pasaraya event. And this is the National Dementia Plan launch in March, launched finally by the Ministry of Health, and all these activities related to training and the infographic. If you go to alzi.or.id, you'll get this information there. And the brochure of 10 warning signs are also translated to Arabic. Alzheimer Monaco and Morocco asked us to help. And the Alzheimer, the Javanese, Ojo Maklum Marang Pikun, it was requested by Suriname. So there's many Javanese people in Suriname. Can you imagine that? Like, not Javanese people ask us, but here in Indonesia, but the ones in Suriname wrote a letter and say, we want to get your brochure. And I'm like, in Indonesia? No, in Javanese. Okay. So that's one of the things why key messages and communication tool is important. And of course the Netherlands, the Dutch, and the French version. So these are things that you can use. And I was talking about Purple Troops, and also there's an intergeneration home visit. So with partnership, we really we are trying to explore partnerships with other organizations and private sector, because the dream is to be the platform of young people, millennials, to support and contribute their time for the elderly. And some of the young people actually visited the elderly and people with dementia by singing all these old songs. So they have to stimulate their brain in singing Elvis Presley's song. They know Justin Timberlake songs, or the Kekinian songs, but they don't know the oldies. So that's also helping the young people to stimulate their brain to avoid getting dementia. And the Purple Troops with the social welfare, they help. And it was, if you Google or YouTube, Al Jazeera actually produced a documentary on Purple Troops, so they call it Purple Squads. And we also had that picture taken with Jarod and the previous governor in front of Monas. It's all in purple the whole month. So, because purple is our branding, and that's why I'm wearing purple. And thank you, Judy, who's also wearing purple. I didn't expect you to also, wear that color. But it's a branding that we constantly visibly share. So we're Alzheimer's Indonesia now. The achievement for the past 6 years, we are the ones or organization that always promote the care for elderly, especially people with dementia. We promote healthy lifestyle. We did all these run and fun walk and all that. We advocate to the government to have policies, not only in the national government, but also in Bali and in Jogja. Today, there's a training of Balinese Purple Troops, as per today, because the governor is actually interested to explore more. And that's something that we are very excited, not only having Jakarta. And Jangan Maklum dengan Pikun tagline, the go-to source of information. So some people go to the doctors, but complain because of the long waiting, and people who approach us really want to be navigated on this journey. This is an ideal proposed integrated community care system policy that was discussed in Japan, because Japan is very advanced. So there are the integrated management service. So ideally, someone's home is really near where the nursing home is, and there's home care visits and all that, the daycare center. And because, you know, the traffic jam could really affect people with dementia and families. And that's something that we are constantly trying to figure out how we can help. And this is just a framework from WHO and Alzheimer's Disease International. Like in terms of partnerships and places and people and all the resources, you can look at your PDF. But the impact long term is really, really related to establishing a dementia-friendly environment. So dementia-friendly or age-friendly environment is a place that people with dementia are being respected. You know, I still remember when my mom, you know, was so confused in the store. You know, so if it's a dementia-friendly, we need to train the staffs at the store and the police, you know, and to know that these are the symptoms. And it could be also, you know, linked to other organizations or industry. And linked to the nutrition part, we also produce a book with one private sector, and this book is a storytelling for kids, because the kids or the grandchildren notice that the elderly forget their glasses and put it in the fridge, for instance. And young kids are, you know, grandson, granddaughter are also change agents on this. So these are examples of all the partners, local, international stakeholders from media, private sectors, government as an example, and we maintain relationship with them. And the photo on top is one of our volunteers, Dr. Sophia Hake. She's a sports medicine doctor, and we actually did, and Judy was involved on that as well. We did an hour session in all high school, junior high school, and vocational school, only during the first 3 days of Masa Orientasi Siswa, the first 3 days of the first days of school. And the photo on the bottom is the caregivers meeting support group from only 12 people. Now it's spread to 100,000 in 21 chapters. And all the highlights and impact, you should be in the website. So yeah, that's it. Thank you so much. I hope it's useful for your advocacy and partnership in relation to nutrition. I'm happy to answer or have a discussion. Thank you.